Watch this.
The COVID pandemic has put a lot of things on pause over the past year and a half. But just as we were thinking we were moving forward, we're moving backwards to recommending masks indoors. Caught in the middle of this time warp, local businesses, who not that long ago were on the business end and front line of trying to enforce mask requirements. What does that enforcement look like this go-round? Despite the availability of a COVID vaccine, hospitalizations continue to increase, specifically among those who haven't had the shot.
And our ICU is full. It is totally full.
A desperate plea from a St. Al's ICU physician. One could wonder, after a year and a half of this pandemic, are we in a better position than we were a year ago? A year ago, this week, bars were still closed, at least in Ada County. And Central District Health, because of the rate of transmission of COVID, was considering closing gyms to further restrict gatherings of 10 or more. Today, while bars and gyms are fully open, even fully vaccinated people are being told to possibly take a step backwards. New mask guidance from the CDC suggests masks, once again, be worn indoors, even by those fully vaccinated against COVID, to help curtail this spread of the very contagious Delta variant. This is a reversal from what they told us back in May, when they said fully vaccinated people no longer needed to wear masks. The city of Boise becoming the first to implement this rule today, saying you must wear masks in all city buildings. This recommendation comes with a caveat, though, from the CDC. In their suggestion today, the CDC said to maximize protection from the Delta variant and prevent possibly spreading it to others, wear a mask indoors in public if you are in an area of substantial or high transmission. There's that distinction, that area of substantial or high transmission. So what does that mean? Is Idaho in that range? Well, we've certainly seen an increase of COVID cases of late. For example, on June 18th, which was a Friday, Idaho had 54 reported positive cases across the state, just 54. Now, last Friday, July 23rd, we had 282 COVID cases reported. Yesterday, 373. That included the weekend, but still. Is that enough to qualify us as an area of high transmission? Well, as a state, we're not quite in that category, but the CDC breaks it down by county. And their definition of high transmission goes like this. If there have been 100 or more cases of COVID-19 per 100,000 residents, or a test positivity rate of 10% or higher in the past 7 days, that is how they determine if it's a high transmission. So this is the Idaho data on their website. Right now, these areas in red that you see here, highlighted in red, there are 14 of them in Idaho's 44 counties. They are considered high transmission counties. And according to the CDC data from last week, that's July 19th through the 25th. And that would include Valley County right here on the screen because of the 114 cases per 100,000. Twin Falls, that's down here at the bottom, 127.8 cases per 100,000. And they also have a percent positivity of 10.48 in Twin Falls. And there are 12 counties close to that criteria, including Ada and Canyon counties. You can see Ada County right here. That total, well, their totals, according to the CDC, Ada County is this close to that high transmission category into what we call the substantial category, the orange. We have a transmission rate of 88.67 per 100,000 and a percent positivity of 9.9. So yes, this close. Canyon County, 75.7 per 100,000 in the last 7 days and a percent positivity of 8.41. So for clarification and to add to a whole lot of confusion, this CDC data doesn't quite mesh with the information gathered and made available by the state of Idaho or even the health districts around Idaho. For example, Idaho's Department of Health and Welfare show Ada County's rate per 100,000 at just 12.9 over the last 7 days and a percent positivity rate of just 5.1% during that same time. According to the state of Idaho, the highest Ada County has ever been was a percent positivity of 17.6% back in the last week of October. We did ask Health and Welfare about this discrepancy, and we're told there are several reasons for it. They range from data collection dates to duplicate entries that the state has to go through and fix all those things to make it more consistent. There's also this per 100,000 parameter, and that would work in Ada County where we have, well, more than 100,000 people, but not so well in like Lincoln County with just a population of just 5,000. You have one case in those 5,000 in Lincoln County, then you extrapolate that to 100,000 people. It seems like it's a high rate. so it doesn't quite work. Regardless, the CDC recommended today masks be worn indoors by both vaccinated and unvaccinated people in areas of high and substantial transmission. And they went further with their suggestion, saying all students and staff, that's kindergarten through 12th grade, should wear masks in class when they return to schools next month. This is also regardless of vaccination status, because as you know, 12 and above can now get the vaccine. Idaho's two largest school districts had already decided masks would be optional this fall, unlike last year when they were required. So we asked both Boise and West Ada school districts how this might change their protocol. Boise offered this, saying they need time to review the new guidance. We will be meeting with our healthcare providers, our healthcare partners, that is, to discuss this new guidance further and its potential impact on our COVID-19 response plan. West Ada explained it this way, saying their pandemic plan has multiple layers of strategies and evaluations to help them decide what to do. They reminded us it is flexible, and they do consider national and local health guidance, but they tend to lean more into the district data. Back in June, they decided the superintendent would make these decisions, and today's CDC guidance, they said, will not change the existing plan. As of right now, masks are recommended in West Ada schools, but not required. But the superintendent could, of course, certainly decide to change that. And we are 3 weeks from Boise school starting and about 4 weeks from West Ada's first day. West Ada has a special board meeting tonight, but their next one is until August 24th. And Central District Health, who over the past year has made these recommendations to schools, is still down a member of the board. And they don't meet again until August 20th. So unless we see some special meeting scheduled, it looks like we probably won't see any changes to school mask guidance anytime soon, or at least before school starts. So the schools have some things to consider, or not. But what about local businesses? This recommendation this afternoon that everyone should wear a mask indoors, vaccinated or not, in a public setting, in places of high and substantial transmission, well, that would apply to a lot of places, like restaurants, retail stores, and gyms, to name a few. See why it seems like it's last summer all over again? And remember the fighting and the fatigue that came with mask requirements back then? Are businesses ready to get back into that again? Here's Katya Stepovic.
We're kind of ready for a break.
Just when many business owners and employees itch for a break,
It wasn't really fun to come to work.
the CDC now urges the masks to return, leaving business owners once again in a predicament.
I don't know what to do. I want to protect the community, but at the same time, I also want to protect my mental stability with not having people yell at me or say that it's a hoax.
Sierra Haven Hunter, owner of Dragonfly Boutique in downtown Boise, says she plans to abide by the CDC's updated recommendation to recommend all customers and employees to wear a mask regardless of vaccination status. But she's not looking forward to the potential blowback.
We'll probably just have to wear masks again. I'm over it. But I want it to just be, I want my kids to be able to go to school. That's really what it boils down to. So yeah, I mean, I guess we're going to put signage up again.
She adds lately the store has been receiving criticism for not requiring masks as the Delta variant rises. So now it's a better safe than sorry approach.
This whole issue has been politicized to like an absurd extent. The attention to hand washing, the attention to sanitizing and wearing masks has worked. The record exchange is like fully in favor of that.
John O'Neill, a general manager at Record Exchange in Boise, says the store doesn't know exactly how they will incorporate the CDC guidance, but if they stick to what they've done in the past, they won't ignore it.
We took steps as warranted, as new information came out, and studied the science, studied all of the things. None of the decisions we made were made lightly. And this is no different.
Although right now masks are optional, O'Neill says the Record Exchange was one of the last businesses to lift the mask mandate following the city's announcement in May.
We are going to do what is best for the store and what's best for our customers. Because without the people coming in the front door, we don't have anything here. We don't want our customers dying, frankly. Yeah. That's the Record Exchange position in a nutshell.
As tired as we may be, we aren't out of the woods yet.
Everyone just needs to get vaccinated. That's all there is to it.
Nobody likes it, and having to do it, this past year and a half or so has really sucked. But we have to protect each other. Nobody has a choice about that.
I reached out to Health and Welfare to get the state's response to the CDC's updated guidance, and they said this. They said, "We are concerned, as CDC is, about the growing numbers of cases and hospitalizations in the country and the state as the pandemic continues to evolve. We know the Delta variant is in Idaho and is spreading, and we hope Idahoans will choose to protect themselves and those around them by getting vaccinated and following the recommended guidance." Brian, it is truly like Groundhog Day. Many businesses are brainstorming once again and trying to figure out how to switch gears moving forward. So we'll just have to wait and see what they all decide.
And you can almost feel that frustration from these business owners having to deal with this again. If we could make one other recommendation to go along with that CDC recommendation, don't take it out on the business owners or their employees if you decide to shop in their stores. Thanks, Katya.
We had a 37-year-old die yesterday from COVID. Again, preventable. Had that person been vaccinated, they would not have died. And I believe that very strongly.
Another appeal from an ICU doctor as hospitalizations among the unvaccinated continue to climb. Well, if you're new to the 208, let us know your thoughts about the show. Here's our number, 208-321-5614. You can send us a text with whatever questions or comments you may have. Just be sure to include your name and the hashtag, the 208. Oh, and stick around. We're going to share as many as we can at the end of the show.
You feel like, what am I doing? I'm standing here trying to get somebody who is at risk of dying from this through this, and they're still telling me that it's not real.
It's unbelievable. Since day one of this pandemic, a major metric in how successful we were getting a handle on this has been our extreme cases of COVID, our deaths and hospitalizations. And those numbers, at least those in our area hospitals and ICUs, have been on the rise the last few weeks. We've gone from statewide numbers in the teens to those currently in the ICU in the 40s. And instead of just telling you the numbers and showing you the data trends, we wanted to get some perspective from someone who works there in the ICU with COVID patients to give you an idea of the firsthand battle our frontline healthcare workers continue to fight. Joe Paris spoke with Dr. Megan McInerney, the ICU medical director at St. Alphonsus Regional Medical Center here in Boise. Her perspective is raw and honest, and it's something you just won't see in those numbers. Here's why.
Initially, things had calmed down. This time last year, we were experiencing quite a significant surge, actually, from a COVID perspective. And then about 2 or 3 months ago, when vaccination numbers were increasing and we were seeing lower numbers of COVID overall, our COVID numbers in the ICU had decreased. Now, unfortunately, our COVID numbers are going back up, not as high as they were last year, but still a high enough percentage of our overall ICU patients are COVID positive. And every single patient in the ICU with COVID is not vaccinated. And our ICU is full. It is totally full. We have patients constantly needing to board in the emergency department. This is the case for the whole hospital. Unfortunately, we don't have any beds available, so patients are needing to board in the emergency department, not just because of COVID, but in the times when we have COVID, it's also now currently peak trauma season.
Compared to what we saw, I guess, last fall and winter to what we're seeing now in terms of trends, in terms of where we're headed, how does it feel? Is it similar? Does it feel different?
It feels very different to me, and here's why. Because it's preventable now, right? So the trends are still, they're going up now, and I'm concerned that we are going to get to the point where we don't have enough staff to take care of the patients. But now it feels much heavier even than it did last year because we know how to prevent it. And that's really frustrating. You know, every patient that I see who comes in and needs to be put on a ventilator because they have COVID, it's hard not to think to myself, this didn't need to happen, right? It is a preventable illness at this point. We are not seeing as many people in the greater than 65 age range coming in with COVID. We're seeing patients now. I have a patient now who's 31 years old with COVID, a patient who's 35 years old with COVID in the ICU. And both of those patients did not get vaccinated.
Are you finding that patients you're treating are telling you, I wish I could get the vaccine, or can I get the vaccine now? I wish I would have had it before?
It's a mix, surprisingly. So some people are, regretful and hopeful to get the vaccine and want to tell their family members and loved ones that, please, if you're not vaccinated, go and get vaccinated, because being this sick from COVID is not worth it. It's not worth, all of the other reasons that people give to not get vaccinated. But there's also some people who just feel so strongly because they've been convinced, quite frankly, by misinformation to not get the vaccine, that they're still convinced that they shouldn't have gotten the vaccine. And that's really, it's hard to see as a physician. It's hard to see as a nurse. It's hard to see as a respiratory therapist or a CNA. All of us taking care of these patients, we are so frustrated and saddened by the fact that they still feel so strongly about not getting the vaccine. And yet they're at risk of dying in our ICU because of a preventable illness. Been tearful at times because you feel like, what am I doing? I'm standing here trying to get somebody who is at risk of dying from this through this, and they're still telling me that it's not real. I had somebody say that to me. And yes, we've had some really sad people who are young die. I had just spoken to, we had a 37-year-old die yesterday from COVID. Again, preventable. Had that person been vaccinated, they would not have died. And I believe that very strongly.
I've spoken with members of our community that either are choosing to believe we're not in a serious situation or they're just completely unaware of what's going on. To people in the community that do not understand what you and your staff are going through on a daily basis in the ICU, people that think the pandemic's over, what message would you have to them in terms of how serious of a situation you're dealing with right now?
I think my message to them is that the pandemic is not over. Getting COVID oftentimes will not result in severe illness, but it really can. And people get very sick from this. People are dying from this. I had a 37-year-old patient die from COVID yesterday. Okay. For people who don't believe that you can get really sick from this, they are just wrong. And not seeing the reality of what's happening. I wish we could invite them all to round with me in the ICU to see it firsthand. So my message would be, get the vaccine. It is our way out of this. For those of people who saw me in December last year when I got the vaccine, I was on cloud 9 because I knew that was our exit point, right? That was the only way that we could get to a point where we don't have to deal with these kinds of sad cases anymore. So it's not over. We're in a different phase of it. We know what to do about it. And I just would beg our community to do what we know we need to do and follow the science.
That vaccine, she said, was their exit point. She saw it as such. But from the beginning, we talked about the difficulties and the frustrations our healthcare providers face with this pandemic. It's a different look of it, but it's still frustrating and difficult for them.
Yeah, and the truth is they continue to work through it, and it's because they have to. And when you talk with ICU doctors, like we just heard from, I say is, you get frustrated with this and they don't believe it's happening, but yet you still continue to treat them. I said, of course we continue to treat them. That's our job. We took an oath to save people's lives and to make people better and to do our best. Whether they believe in something or not, frankly, when they're intubated, it doesn't matter. It is so frustrating for our frontline healthcare workers, as we heard, and it'll continue to be frustrating, and that's just the truth.
Thanks, Joe, and thanks, Dr. McInerney, for that portrayal, that honest portrayal of what's happening in our ICUs right now. Summertime in Idaho, perfect time to get out and explore our giant outdoor playground around the Gem State, especially for those of you who may be new to the Gem State. We're not going to expose some of the best kept secrets, so don't worry about that. We know we would get, a lot of phone calls and messages about that. But there are some pretty well-known attractions out there that are sometimes hard to find. One viewer was able to capture that sentiment pretty well in this edition of, What's Your Sign? Today's edition. Lisa Hayna posted this picture at our Idaho Weather Watchers Facebook page last week. You can see the sign says hidden entrance, 500 feet as the road winds through the desert. Hidden entrance. How hidden is it? What are we talking about here? Why is there a sign for something that's supposed to be hidden? All questions, right, that we all have. Turns out it is a hidden entrance to the campground at Balanced Rock. Look how beautiful that is. If you haven't been to Balanced Rock near Castle Ford in the Magic Valley, you want to make it a priority. It's a pretty amazing sight to see, as you can see there. So yeah, is it hidden? Well, a lot of people think it should be, but there's also that sign to let you know you're close, you're getting closer. So keep sending us those hidden gems you found along the way, and we love showing them on this show to show everything the Gem State has to offer. That's why we're called the 208. And you can send them to any of these spots: Facebook, Instagram, Twitter, email, the 208 at ktvb.com. All right, just about 30 seconds to go in the show. A lot of angry text messages today about the coverage we chose to bring you today. But let's go with this one. Brian, with your tone today, you're sounding like wearing a mask is a bad thing. It's not. People need to get vaccinated. We can get through this. Not saying that wearing a mask is a bad thing, but can you sense the frustration from everybody who feels like they've done everything they can to only be back in that situation where we're wearing masks again? I think a fully approved vaccine would go a long way towards getting people vaccinated. Well, maybe not. Not sure about all of that. Thank you for the time your 2A team has taken to educating and informing. The work you do may help to change hearts and minds. Thanks, Jennifer. I'll see you tomorrow.